So thank you for coming. My name is Oliver Escobar. Part of the BR UK team at the University of Edinburgh. We are delighted to host this webinar this morning, and thank you for joining us. We have a very rich set of presentations and a bit of a panel discussion, as well as time for Q&A. So let me just show you the agenda for the webinar. Next, please. First, I'm going to offer a little bit of an overview about public engagement and stakeholder involvement in the context of research and policy. Then we're going to look at the centerpiece for the webinar, which is the scoping review that we have conducted to try and map the level of activity happening in behavioral research with regard to public engagement and stakeholder involvement. We're trying to understand what is happening in the field, what are the strengths, what are the weaknesses, what needs to happen for this community of practice, this community of researchers to move forward with a good public engagement and stakeholder agenda. And hopefully by the end of today, you will see the relevance of that, why it matters, why should we care about it, why should we invest in it. Then we're going to have a small break, just a comfort break, and we will follow up with the panel discussion just to get a little bit of some reflections, and then we're going to head up to the Q&A. But you can add your questions to the Q&A box all the way through the presentation, so you don't need to wait. Please do add your questions there, and then we'll do our best to address most of them, or as many as possible, by the end of the webinar, and we will be closing at 11 o'clock. So the chat function is enabled for the webinar, so you can it's always nice to hear where people are. So if you don't mind introducing yourself, just your name and where you are, that's helpful for us to understand the range of people who are in the webinar. And then, as I said before, you can submit the questions through the Q&A box, ideally indicating who the question is for, and then you can use the upvote function for any relevant questions that you particularly like, so that you can support those so that they come to the top of the list. Okay, next, we should say what BR UK is. Behavioural Research UK is a new consortium funded by the Economic and Social Research Council, and is working to provide a leadership hub within the ESRC program on national capability for behavioural research. We've been going for just a year, actually, and we have another 4 years ahead. Next, please. But today, the main focus is public engagement, because BR UK has a strong commitment to support public engagement in the field of behavioral research. We want to make sure that people feel supported to carry out this kind of activity. So over the next few years, we're going to be providing training that will be available. We'll say a little bit more about that towards the end of the webinar. But first things first, what is public engagement? Why does it matter? How does it work? What kind of work does it do? Why should we care? So in this webinar, we are going to provide an overview of the field of public engagement in research and policy. We're going to show some examples. We're going to share the results of our scoping review that explores the role that engagement and involvement approaches is having across the UK-based behavioral research community. And we're going to reflect on how and why meaningful engagement is an important component of research, and certainly in any kind of research that is seeking impact and affecting change. Next, please. Today's speakers, you can see that we're going to have a range of colleagues: Julze Alejandre, Niamh Hart, Madeleine Baxter, and Phoenix and Carrie Heitmeyer. Some of them are going to do presentations, some of them are going to be part of the panel discussion. So we will introduce them as we go. Next. Next. So. Public engagement, we have a National Centre for Public Engagement in the UK for the higher education sector and for research institutions. It's based in Bristol. It's been going for many years now. They define public engagement as the ways in which the activity and benefits of higher education and research can be shared with the public. And it is by definition a two-way process involving interaction and listening with the goal of generating mutual benefit. Now, the importance of public engagement and stakeholder involvement cannot be overstated. It really is at the heart of any kind of attempt at providing research that is useful to policy. And there was a recent report on public trust in science for policy making that reiterates what we have known for many years now, for decades, that policymakers, researchers, and knowledge brokers need to deepen their engagement with publics to build trust in science. And particularly at a time where there is so much mistrust in politics and policy. It's on us as researchers to really take all kinds of publics and communities with us as we engage in research and policy work. Next. So why public engagement? The library is full with studies and reports and books and articles showing the value of public engagement empirically, but also theoretically, normatively, as something that we should do because it's the right thing to do. But there's also an instrumental value to it. It is about improving legitimacy and capacity, addressing complex problems by tapping on knowledge that otherwise is not accessible. It is about empowering citizens and communities so that people can develop their own skills, confidence, and capacity to play a role and influence research, policies, decisions that affect their lives. It is about improving social cohesion, fostering new forms of solidarity, increasing trust, collaboration, and ultimately to improve the quality of decision making. And that means legitimacy to make difficult decisions. It means more socially inclusive decisions. And it means decisions backed by well-justified evidence and reasons. Next. But not all public engagement is necessarily desirable. There is a lot of tokenistic, symbolic public engagement that really doesn't add value and actually can create cynicism. So we need to be mindful that it's not, we shouldn't do public engagement for the sake of it. There is a lot of shallow public consultation that lacks empowered engagement, where we really work with people rather than just doing it because it's a ticking box exercise. And there is across the world what we call the participation gap, which is the growing gap between the politically rich and the politically poor. That means those who know how to influence the decisions, the policies, the research, etc., that affect their lives, and those who don't. And that's a growing gap that we need to be very mindful of, because ultimately our license to practice research, our public license to practice research, is at stake. So public engagement, unless it is supported by corrective measures, will tend to be skewed in favor of some groups over others. And we need to be mindful of putting in place the right mechanisms so that engagement is properly inclusive, meaningful, and relevant. Next. We have done a lot of work before BR UK that is fitting into what we are doing now. One of the challenges, and sometimes you will see this in policy documents, the term hard to reach, how to connect with people who are hard to reach. But in our experience and some of the work we've done before, it's more a matter of people being easy to ignore. Most people are quite happy to contribute and join and support the kind of work that we do if they are offered meaningful roles. So we need to recognize the diversity of publics and communities that we all work with. When we say community, we mean community of place, of course, but sometimes it's a community of practice, sometimes it's a community of identity or interest. And one of the key challenges is to get beyond extractivist research that just takes from people without necessarily giving something back or without taking people along the process with you. And that can generate mistrust, alienation, and cynicism. Next. Now, there's a wide spectrum of engagement approaches. This is not to say that some are better than others. It really is a matter of context. It's a matter of choosing the right type of processes for the right type of context. But there are different degrees of involvement, from informing people to conversing with them, to consulting them, obtaining inputs, to involving people a bit more deeply, collaborating, or empowering people to actually make the decisions themselves. And all of these have their role in different research contexts. It's a matter of matching the type of research we are conducting, the type of impact we are seeking, the type of policy work we are carrying out, and then deciding what type of engagement is adequate in that context. Next. Just a couple of examples before we move on to sharing with you the scoping review. These are examples that just illustrate the different ways in which you can place public engagement and stakeholder involvement at the heart of a research program. One example is What Works in Scotland, which I co-directed. It was a 5-year program funded by the ESRC and the Scottish Government. And we did well over 60 different research projects, and all of them had stakeholders involved and sometimes communities involved. For example, the development of the national standards for community engagement, which are applicable across 200 public institutions in Scotland. These were developed through a very ambitious stakeholder process that included well over 500 people in shaping those standards. Some of the work we did in communities, particularly with community-anchored organizations like housing associations, like community-owned businesses, and so on. That was done in direct collaboration with people based in communities of place. So these are just examples just to show that we can do this at a scale, and it can be a driving force of the research and a driving force of making sure that the research has a grounding in reality that then helps to make better policy. Next. A different example is a European project in which we wanted to understand how people make a difference in urban neighborhoods, especially in neighborhoods that are challenged by social exclusion, poverty, and so on. So this was a project across 4 European cities. And it was a co-production project in which we worked with local practitioners, public servants, local activists, people working in the charity sector, as well as working in public institutions. And they shaped the agenda for the research. They helped to carry out the research. They helped to interpret the research and make sense of their own situation in those neighborhoods, in those cities, then shaping all the outputs of the research through that collaborative process. And finally, another example, just a very different example, is a citizens' duty on health inequalities, where we wanted to understand how do citizens prioritize different policies in order to tackle health inequalities. So citizens' duties include members of the public, randomly selected, so that they represent a cross-section of the population in terms of socioeconomic background, education, age, gender, and so on. And this is a very different approach to public engagement. It's one that is becoming increasingly popular in policy spaces because a citizens' duty or a citizens' panel or citizens' assembly is a process through which people get to engage with existing evidence and develop recommendations that are well informed and therefore particularly useful to policymakers. Okay, those are just some examples and a little bit of context. So thank you for hanging in there. But now we come to the main the centerpiece for today. So I'm going to hand over to my colleague Jules, and we are going to get to find out what is it that we have discovered through our scoping review. What do we know about the field of public engagement and stakeholder involvement in the context of behavioral research in the UK? Jules.
Thank you, Oliver. Good morning, everyone. My name is Julze Alejandre. I'm a research fellow in public engagement at PR UK here at University of Edinburgh. So today I'm going to share the findings of our rapid review that explored the scope of applying public engagement and stakeholder involvement approaches in UK's behavioral research landscape. I'd also like to acknowledge the contributions of my colleagues at PR UK for this review. Next slide, please. So this is the outline of my presentation for today. Next slide. So I would like to start by saying that behavioral research evidence is essential in informing policy and interventions for various societal challenges such as climate change, health inequalities, building resilient communities, and developing national and local economies. And generating good quality, robust, and collective knowledge from behavioral research requires inclusion of diverse voices from various population groups, which could be achieved when appropriate, inclusive, equitable, and meaningful PESI or public engagement and stakeholder involvement approaches are applied. So when these principles are considered, these PESI approaches could provide spaces for cross-pollination of diverse knowledge. It could enable co-production of context-based and collective knowledge, and some PESI approaches could also empower citizens and communities by helping them develop their agency, their capability, and their capacities in resolving challenges that are relevant or important for them. However, the scope on the application of PESI approaches in UK's behavioral research landscape is currently unknown, specifically what its purpose, its targeted population groups, the methods used, as well as the strengths and weaknesses in applying such approaches. So hence we conducted this rapid scoping review to investigate this gap. Next slide, please. So specifically, we aim to map how PESI approaches are applied in behavioral research areas in the UK, mainly within BR UK research themes on environment and sustainability, health and well-being, resilient communities, and economic development. We also aim to synthesize identified strengths and weaknesses on the application of these PESI approaches, and also provide recommendations to strengthen the application of meaningful and sustainable PESI approaches in behavioral research in the UK. Next slide, please. So to achieve those aims, we implemented a rapid scoping review between July and November 2024, following the updated methodological guidance for conducting scoping reviews by Peters and colleagues. Next slide. So we considered 3 sources of records, specifically databases of scientific articles such as Web of Science and Scopus. We also considered government websites such as UK government website, and as well as devolved government of Scotland, Wales, and Northern Ireland. We also considered websites of UK funding organizations that usually fund behavioral research projects. So for example, UKRI Research Councils, NESTA, National Institute for Health Research, Wellcome Trust, among others. Next slide, please. So we then use this inclusion criteria in selecting the studies for this review. So first, we considered records or studies as behavioral research if it involves factors or conditions or exposures to interventions that aim to change behaviors. We also included studies that focus on BR UK research themes such as climate and biodiversity crisis, health inequalities, health promoting behaviors, physical and mental health, as well as resilient communities, specifically on child safety, housing and transport, and also on economic development, specifically on interventions for changing behaviors of consumers or workers. So since we are also interested on the use of PESI, we only considered studies which had PESI approaches based on the different approaches shared by Oliver from the spectrum of engagement, of public engagement. And finally, we only included scientific articles, reports, policy, and consultation papers, which were published between 2014 and 2024 by UK and devolved government and also by funding organizations in the UK. Next slide, please. So in total, we had 7,655 records, which underwent rapid and proportionate double screening. So after initial title and abstract screening, we had 643 records, which underwent full text screening. And after full text screening, we have 307 studies included in our scoping review. So data from these 307 studies were subjected to proportionate double extraction and coding process. And now I'm going to present the results of the coding and the data analysis. Next slide, please. So in terms of the types of literature included in the review, we included a huge number of reports from government and funding organization, and this is followed by scientific articles. Next slide. And in terms on the intersection of behavioral research, PESI approaches, and research and policy areas. So most studies we included focus on studies that develop or look into developing or improving health promoting behaviors, studies about climate crisis or climate action, child safety, and mental health. So we've seen very few studies that focus on interventions that change behaviors of consumers, studies about housing, and also physical health. Next slide, please. In terms of the progression in behavioral research publication, our review suggests that in the past 10 years, we have seen an increase in the number of behavioral research literature that use PESI approaches, specifically between the period of 2014 and 2021. In 2021, for example, many behavioral research literature was published, specifically those that focus on COVID-19 pandemic. And this may suggest the influence of the COVID-19 pandemic on the interest and importance of engaging with the public and other stakeholders when doing behavioral research during that time. Next slide. And in terms of the purpose for using PESI approaches in behavioral research, many studies we included aimed to consult the public or certain stakeholder groups. So if we go back to the spectrum of engagement shared by Oliver a while ago, consultation process is at the other end or at the lower end of the spectrum. And this may be because consultative processes are much easier to organize and implement. It may also be because many behavioral researchers are more comfortable or more capable in applying this engagement process, or maybe because they are not trained in doing higher level of engagement processes that are at the other end of the spectrum. Next slide, please. So we also coded the studies in terms of the commonly used PESI approaches. And based on this review, the most common PESI approaches used are interviews, surveys, focus groups, and workshops. So notice that these are also some of the common data collection methods that many researchers are trained to do. There are very few studies that use higher engagement processes such as citizens advisory committees, for example, or deliberative polling or citizens juries as shared by Oliver a while ago. Next slide, please. We also map out the profile of individuals who are commonly engaged or involved in behavioral research. So we categorize them as service users and minoritized groups, such as the commons or the publics, commonly adult population who are representative of the UK population, people with lived experience, for example, people with mental health conditions, substance abuse conditions, and people who have carer experience. So we also seen profile of the public who are users of public services, such as healthcare services and transportation services, those who are beneficiaries of bespoke interventions, such as children, students, parents, and elderly population in the braggart communities. And some examples of minoritized communities are members of the LGBT community and refugees and asylum seekers. Other group of stakeholders, we call them service-oriented groups of stakeholders, such as service providers. So examples, healthcare practitioners, teachers, social workers, volunteer workers, or for example, bus drivers. We've also seen other groups such as labor workers, such as farmers, and those who are small, medium business owners, manufacturers, retailers, and employers, and also housing owners. And the other group of stakeholders that we've seen in the review are expert groups. So examples of this are scientists, academics, researchers, and other specialist professionals, those who work in the government, such as civil servants, local authority representatives, and also representatives of civil society organizations and learned societies. Next slide, please. So in terms of the strengths on the application of PESI approaches in behavioral research, we can say that some of the research that we've seen employed creative methods that elicit in-depth data. So example of these methods are walking interviews, storytelling, employing games, for example, or photography, drawing, and other co-creation workshops, for example. Some of the research also enabled long-term engagement with target population groups. Some of them also use engagement processes that help build a level of trust, empowered the communities that they're engaging with, and facilitated collaboration among the interested parties. Some of the research also provided a space for meaningful dialogue and deliberation between the participants. Some of them also employed ethical approaches and provided compensation or training to the target groups that they are investigating or engaging with. They also utilize approaches to ensure that the research is inclusive and involve diverse groups who are relevant to the research context by ensuring that the inclusion of voices or multiple and diverse individuals. Some of the research also used validated tools such as questionnaires and interview guides, and some of the research also employed multiple methods that elicit multiple types of data for validation and triangulation. So the common example of a mixed multiple methods are a mixture of interview, surveys, and workshops. Next slide, please. So we also identified some weaknesses such as the use of online formats or processes of knowledge sharing or deliberations, which could alter group dynamics and reduce opportunities for deeper interaction among participants. So there are also some engagement processes that did not resolve misunderstanding and skepticism among those people that they are engaging with. While there was also an effort to be inclusive, many studies failed to tap relevant voices and community representatives who hold relevant knowledge about the research topic. There's also cross-sector exchange or pollination of knowledge diversity. There's also limitation on cross-sectoral exchange or pollination of knowledge and diversity, as well as intersectionality of the research participants, which may be a cause of concern because some of the research that we've seen failed to involve individuals from other sectors, making the engagement a bit of like a homogeneous engagement. So for example, some research are only engaging with a group of academic experts who are considered homogeneous group of people. So there was also a selection bias towards people with pre-existing interest in the research topic and failing to reach out to those who might have negative views or perspectives about the topic that they're researching. And while there's an effort to engage, many research also lacks details on how to sustain the engagement after the project. And lastly, considering that longer engagement processes involve diverse individuals and sectors, and this would require higher research budget, many projects had limited time and resources for meaningful and sustained engagement. Next slide, please. So in conclusion, initial findings of our rapid scoping review suggest that for government agencies and funding organizations, evidence from behavioral research is important. And this can be seen from the breadth or the number of behavioral research literature that we've seen in the review. So in the UK, many behavioral research projects focus on health, climate change, and intervention for safeguarding children. We interpret this as the need to promote behavioral research with meaningful public engagement and stakeholder involvement approaches to answer other societal challenges, such as in transportation, in housing, and interventions for changing behavior of consumers, for example. Next slide, please. So finding from this review also suggests that many behavioral research projects in the UK mainly aim to consult the public or key stakeholders. So we also interpreted this as an indication to promote the use of PESI approaches that will enable higher level of public and stakeholder engagement. And this is evident on the commonly used methods of PESI that we've seen in the literatures, which are considered at the other end of the spectrum and a bit unsustainable kind of engagement processes based on the spectrum of engagement. Next slide, please. So moving on to the case studies that we are going to share are case studies of PESI application in behavioral research, which were selected from the included studies. So we think these are good examples of applying PESI approaches at the two ends of the engagement spectrum. So case study one, which will be presented by Maddie, focus on applying a commonly used PESI approach for an intervention that aimed to improve connections between young people. And the next case study, which will be presented by Niamh, provides an example of an iterative public engagement stakeholder involvement approach involving a diverse group of young people. Next slide. And now I would like to call on Maddie to share the case study one.
Hi, my name is Maddie, and today I'm going to present a case study by James Lawrence titled Youth Engagement, Positive Interethnic Contact and Associational Bridges, a quasi-experimental investigation of a UK National Youth Engagement Scheme. Next slide, please. A study was conducted to examine how youth engagement can foster positive interethnic relationships among adolescents, offering insights into reducing prejudice and bridging social divides. In a backdrop of increasing polarization around ethnic diversity with the rise of far-right movements and support for anti-immigrant parties, there is a crucial need for strategies that promote positive interethnic relations, especially among the youth. Adolescence is a key formative period for developing attitudes towards ethnic differences. However, social structural barriers such as residential and school segregation limit opportunities for positive interethnic contact. Effective interethnic ties refer to close, meaningful connections between people of different ethnicities, characterized by sustained interactions. So the two objectives of this study was to first evaluate whether participation in structured youth engagement programs, such as the National Citizen Service in the UK, leads to the development of effective interethnic ties. And secondly, to assess if these gains in interethnic ties are sustained post-participation. So next slide, please. This study utilised a large-scale, nationally implemented youth engagement scheme in the United Kingdom to consult adolescents, particularly those from segregated areas, in understanding how youth engagement programmes can foster positive interethnic relationships. So there was 3,985 adolescent participants from the National Citizen Service Programme during the summer of 2015. And then in parallel to this, there was 3,985 control group members who were randomly selected from the expression of interest pool of non-participants, and they were surveyed over the same time period. In terms of response rate, the baseline survey saw an 85% response rate among participants and a 41% response rate among controls. So next slide, please. The study employed a quasi-experimental design since random assignment was not feasible. This approach allowed for an evaluation of the impact of the National Citizen Service programme on interethnic ties by comparing changes over time between the participants and the control group. A difference in difference approach was used to measure changes from before and after in the programme of both groups. Data collection included pre-test surveys at baseline and post-test surveys 4 to 6 months later. A mixed mode approach was used with postal surveys at baseline and both postal surveys and online surveys for follow-up. The measure of interethnic ties in the study is based on effective interethnic ties. This was measured by a specific question asked in both the pre and post participation surveys. Now, think about people you know and who you'd feel happy getting in touch with to ask for advice or a favor. How many are from a different race or ethnicity to you? The participants were then able to respond using a 4-point scale. So moving on to the outcomes, next slide, please. So it was first found that participants from the National Citizen Service scheme experienced a significant increase in effective interethnic ties compared to the control group. It was also shown that these ties persisted 4 to 6 months after the programme ended, suggesting a sustained impact on participants' relationships. The programme also appeared to be particularly impactful for youth from more residentially segregated areas. These participants started the programme with fewer interethnic ties compared to their peers from more integrated areas. However, by the end of participation, they reported just as many interethnic ties as those from less segregated areas. This highlights what was called the associational bridge effect. The program effectively bridged the social gap for those who had fewer everyday opportunities for interethnic interaction. There was also no significant difference in ethnic diversity of participants' local areas. This suggests that the National Citizen Programme can foster interethnic relationships regardless of existing diversity levels in participants' communities. Next slide. So now to go through the strengths and weaknesses. The use of the nationally implemented youth engagement programme provided a robust data set allowing insights on real-world scenarios. The participant demographic also aligned with a broader population, adding validity to the general insights. The quasi-experimental design and difference in difference approach enabled the study to assess change over time, as well as the pre- and post-test surveys enabling structured timing to capture these effects. The multi-model of surveys also increased accessibility. Now for the weaknesses. The use of only one measure of interethnic ties limits understanding of the nuances of engagement, such as the quality or depth of intergroup relationships formed. The lack of random participant selection means pre-existing differences might influence outcomes, affecting the reliability of conclusions about engagement effectiveness. Non-responses or missing data could limit the general applicability of the findings, as some youth might be underrepresented. And finally, without directly measuring team diversity, understanding the influence of team composition on engagement of these results is limited. So now moving on to the conclusion and insights. Next slide, please. So the study showed that public engagement in study designs can enable researchers to capture data within realistic settings. The main findings uncovered that discrete periods of youth engagement can lead to increases in young people's interethnic ties, reducing social divides. This underlines that programs engaging with the public directly, particularly in segregated areas, can bridge social divides by creating natural settings for intergroup contact that might not occur otherwise. The study also showed positive effects across diverse areas, indicating the potential for program effectiveness across different community types. Finally, this study also showed that engaging participants in study designs over a period of time, including follow-up assessments or surveys, provides valuable data on the sustainability of effects, emphasizing the importance of continuity in engagement for lasting outcomes. Thank you. I'm now going to pass you on to Niamh.
Hey, hi everyone. I'm Niamh Hart, a BR UK Research Fellow based at Edinburgh, and I will be showcasing one of the studies included in the scoping review, which was the UK Chief Medical Officer's commissioned work by Brett Smith and colleagues at Durham University and the University of Bristol to facilitate communication of national physical activity guidelines to disabled children and young people. And before we go on, it's important to note the terminology used here. So numerous definitions of disability and ways of identifying as disabled exist in the UK. Some people and organisations prefer to use the term disabled people, while others prefer to use people living with disabilities. However, in this presentation, we are going to be following the author's use of the social model of disability, and therefore the term disabled people will not be used. Next slide, please. So to provide a little bit of background, the academic team at Durham and Bristol were commissioned to complete a two-phase approach to developing the new physical activity guidelines for disabled children and young people. And they did this by firstly conducting a rapid review of the evidence on physical activity and disabled children and young people to provide the basis for the public health guidelines. Now, this review concluded that for disabled children and young people, some physical activity compared to none is good, but more is better. And to experience substantial health benefits, they should engage in around 120 minutes to 180 minutes of moderate to vigorous physical activity per week, with the inclusion of strength and balanced focused activities 3 times a week. Next slide, please. Phase 2 of this commissioned work included the use of co-production with a diverse range of disabled children and young people and parents and carers to consider effective communication methods for these new guidelines. This work would also provide schools, health and social care professionals, and disability and sport organisations with evidence-based recommendations to support the promotion and inclusion of physical activity in disabled children and young people. And in terms of participants of this work, the academic team recruited over 200 children and young people with a diverse range of disabilities, 73 parents, carers, and 7 teachers. There was also national disability organisations included and 33 education, health and social care professionals. And so it was a really well-rounded group to provide expertise and lived experience. Next slide, please. So the team used an equitable and experientially informed co-production process, which is defined as a collaborative process in which the lived experience and knowledge of particular communities is considered essential. And I've broken the process of this work up into 5 main stages, whereby stage 1 included discussions with children and young people who decided on the use of an infographic as a mode to deliver the physical activity communications. This design of a prototype infographic was first developed by a group of 12 children and young people with its content to reflect new recommendations. A variety of fonts, colours and visual images were also selected as possible options for how the infographic could further be designed in later stages. Stage 2 included the prototype and options being shared with over 100 children and young people and parents and carers in workshops to facilitate discussions about what they believe should be included in the infographic and how it should be presented. The workshops were facilitated either by a disabled young person, a teacher, or an academic researcher. And each workshop was designed to support a dialogue amongst participants so that their voices could interact, disagreements could be honoured, and their views could direct the production of the infographic. The knowledge gained from these workshops was then used to design 5 different infographics, which is stage 3. These infographics ranged in terms of messaging, for example, what words were used, what colours were used, visual images and structure. And the variety of infographics were then shared in workshops, as well as over email with people who took part in workshops at stage 2. The infographics were then shared with a further 100 children and young people and parents and carers. Education, health and social care professionals were then invited to share their thoughts on the infographics through separate workshops. Any new ideas and amendments were then blended into one infographic and brought back to the original 12 children and young people to ensure that lived experience was centralised and to direct the content and structure, and this was stage 4. The final stage of this process was subsequently returning the infographic to all of the participants involved in all of the workshops, and they were encouraged to provide further thoughts on the final product. As a result, several final suggestions were made by children and young people, and it was again returned to the co-production participants for any additional ideas until none were offered. Next slide, please. So the final version, which you can see here, was endorsed by the UK CMOs and published by the Government Department of Health and Social Care on its official website. And if you'd like to view the infographic in more detail, please do scan the QR code on this slide. Next slide, please. Moving on now to strengths and weaknesses of this engagement process. As you can tell by the methods section of this case study, it was a very iterative approach that followed the input and views from many different groups and individuals, most importantly with children and young people of different ages, different sexualities, ethnicity, and in their disability or impairment. Also important to mention here is that this was one of the first co-produced infographics to communicate evidence-based physical activity recommendations for disabled children and young people, and it was approved by the UK Department of Health and Social Care and endorsed by the UK CMOs. One of the only weaknesses of this piece of work is that the authors disclosed that they were unable to include participants at every classification of certain impairments. For example, they were unable to include one classification of cerebral palsy. Next slide, please. So in summary, the infographic was co-produced to foreground experience and knowledge and make the evidence-based messages clear, relevant, and useful for the primary target audiences, which were disabled children, disabled young people, and parents and carers. And then the second target audience, which was education, health, social care, disability, and physical activity professionals and organisations. In doing so, it is hoped that the infographic will have greater impact and speak to those it is aimed at. And this project highlights the power of co-production to deliver meaningful and accessible resources for disabled children and young people and showcases the effective methods for doing so. So thank you for listening to the 2 showcases, and we will now have a short 4-minute break and meet back at 19 minutes past 10. So feel free to have a stretch, get a glass of water, whatever you need to do, and we will commence then.
Okay, welcome back. Hopefully that gave you a chance to stretch your legs and get a tea or a coffee or a glass of water. Thank you for hanging in there. We know we've been doing a lot of presenting, but now it's time to digest and to try and think about what we heard. Um, in many ways, what we are trying to do with this scoping review is to hold a mirror to the behavioral research community and invite reflection on the role that public engagement and stakeholder involvement is playing currently, and where does it need to go over the next few years. So we have a wonderful panel to help us digest these findings and to offer some initial reflections from different perspectives. We are going to start with Dr. Carrie Heitmeyer from the UK Government Office for Science. And she's going to give us a reaction based on her perspective of the interface of science and policy spaces. Then we're going to have Professor Anne Phoenix from University College London, and then I'll offer a few reflections as well. We're going to take around 10 to 15 minutes to do this, and then we're going to move on to the Q&A. So please do go to the Q&A box, add your questions there, questions, points, challenges, again, to help us try and interrogate some of the things that are coming through from the scoping review. Let's start with Carrie. Carrie, what do you make of what you heard, and what kind of reactions do you have to these findings?
Thanks, Oliver, and thank you very much for inviting me to be part of this panel. It's a really exciting topic, and certainly one that I'm really interested in, and I know colleagues across UK government and Whitehall are also extremely interested in. So it's a very sort of timely discussion. So I'll be speaking from my position in the Government Office for Science. So just to give a brief introduction, the Government Office for Science is part of the wider Department for Science, Innovation and Technology, but we report to the Chief Scientific Advisor, Angela McLean. So I'll be sort of reflecting briefly on what I think some of the practical benefits and challenges of public engagement from this sort of policy perspective. And just to note, it was interesting to see Julze's chart around the sort of changes over the years in terms of the number of public engagement reports and research that's been commissioned, and to see that spike in 2021. And I would say actually in the last year, there has also, there's been a new sort of peak, I think, in enthusiasm as well within the UK government around public engagement and deliberatory methods. We have a new cross-government deliberative methods network, which is bringing together people across government departments and agencies working in this space. So there's a new sort of area of sort of coordination, and also I think just general interest. And I mean, just in sort of reflecting on the sort of benefits, I think it's clear, I think on several levels, why it's so important to sort of good policymaking process and good policymaking in general. Firstly, in terms of just being able to better understand the needs and perspectives of citizens that policy is being designed for, and to sort of meet those needs. So to sort of create that broader understanding, and I think related to that as well, I think the role that public engagement can help in terms of helping to make sure that policy that is being designed in a way that it's not sort of designed in a bubble, but it actually, again, can be applied and it implemented successfully within sort of the real world. And then I think lastly, just this point around buy-in as well, making sure that people from different communities and different groups are being consulted through the process is really important to sort of bring people along and sort of to make sure that at least the people being in part of these sort of exercises and initiatives are viewed as sort of integral to that broader process. I think in practice, there's some interesting challenges as well. And I think, again, both Oliver and Julze touched on some of these. Certainly, I think one of them is very much this point around representativeness and who is the public in public engagement. And, fundamentally, you can't go out and sort of survey the entire, the sort of all citizens to understand their needs. So making sure that either the public engagement that is being done actually is fit for purpose in terms of who is being brought into these conversations, but also from the perspective of the policymakers, that they're clear as well in terms of what are the limitations, and that it isn't a representative sample as well. I think another area, I think for me, is that's really important to consider is at what point in the policymaking process does engagement take place? So this is, for me, a really fundamental point. Does it take place after decisions have already been made? And if so, I think then there's problems again around sort of this point around extractivism, which Oliver mentioned, but also using people's time when actually those decisions and asking for their opinions once the sort of policy decisions have already been made. And I think then there's a potential actually for sort of negative impact in sort of trust in government, for example, if there's a sense that people's time and energy are not being sort of maximized, and actually their opinions are not then being fed back into that sort of wider process. And then I think that a final point that I'd like to throw out there as well is, I think, again, sort of linking back to this point around what is public engagement, the risk that it is seen to substitute for other forms of behavioral research and social research, or deep expertise as well. So again, making sure that when public engagement is being used, it is the right method for the research questions that are being asked, and it is not seen as sort of a catch-all to bring in, this very, very broad sort of, bringing sort of the public's into the process, but actually there has been deliberation on the sort of part of policymakers that this is the right method for the questions that are being asked. So I will stop there with these sort of initial thoughts and hand over to Anne, I think.
Yeah, just hold on in there for a second, because I'm gonna take just one more minute to ask you a question, which is it's just a very basic question, but I think people might be interested to hear, because you are positioned in this space at the interface of science and policy. Do you think that policymakers value public engagement and stakeholder involvement? Do you, as in, when they get presented with findings or projects in behavioral research, do they take those that have a public engagement dimension, do they take them more seriously, or are they indifferent? What's your sense of the extent to which this is valued in policy spaces?
I would say absolutely it's valued. I mean, ultimately, civil servants and ministers don't want to make policy that is not going to work in the real world. And I think that there is a recognition that public engagement is a really valuable way of trying to sort of test test assumptions, for example, making sure that decisions aren't being made that actually won't work in practice, and they seem great in Whitehall or in government. but actually, don't make sense, in the real world. So I think absolutely it's valued. I just think also that it's important, these points around at what point in the policy making process it takes these, and I think this is true for research as well, and often, different types of research and evidence. It's really important to bring these in at the very beginning when I think, assumptions are being made. There's more of a likelihood that sort of that very important essential framing of the problem is being made, that you need to have these sort of perspectives and I think grounding to make sure that sort of the rest of the process is sort of, again, fit for purpose.
Great, thank you, Carrie. Anne, let me bring you in. What are your reflections on what we're finding out through the scoping review?
Thank you. And thanks very much to everybody who presented, because I think you gave a very clear idea about the issues that come up in published material very, very helpfully. And also Carrie's comments. I'd like to think a bit more about issues that relate to doing good research, which has been at the heart of what's been said so far. And the first point that I'd want to make is that overall, we can see that public engagement, stakeholder involvement are used much more in certain areas of research. So they're used a great deal in focusing on health and well-being more than anything else, and sometimes environmental issues. So one of the things that I think is important to consider is how do we broaden the scope, indeed, of a work that genuinely engages with the public and so on. And then the targets, because even when children are the focus of a particular issue, they're often not engaged with. So we need to think about who exactly is engaged with. I think the example that Niamh gave showed that when children with disabilities were the focus there, they were engaged with, but that's not necessarily common. And then I want to think about methods a great deal. It really struck me that what was used so much often were interviews and surveys and then focus groups and so on, so that genuinely participatory methods were not so common still. And I think that all the methods that people are using are, of course, useful, produce rich data often and insights that are helpful, but actually sometimes they are, as Oliver said and Carrie reiterated, extractive. They are already top down. And so we need to think about ways that get at meaningful public engagement as well, rather than simply setting the agenda first of all. And then in thinking about how things can be made more meaningful, we need to think about how we include in diverse knowledge, diverse experiences, and so on, and actually build relationships based on honesty and trust. So we need to ask ourselves, are we involving people right from the outset who can help us to define research questions, recognizing that we are positioned in ways that don't always see the main issues? And I think this was something that Carrie was getting at as well. At which point does one actually include people in for participation? So we need to think right from the outset and right through the process to the end in interpreting and so on, and actually give something back. Okay, so my time is almost up. So that one other thing that I would like to say is that it's quite clear that we need to think intersectionally as well, recognizing that because we're picking up one group, it doesn't mean that we're picking up everything, because people are positioned in multiple ways. And therefore, we need to think about how, for example, if we want to include in people with few resources, that maybe racisms and so on stop them from taking up particular benefits or going to particular places. So we need to also think about intersectionality, and I'll stop there.
Yeah, and maybe if you can take a minute just to unpack intersectionality just a little bit. Some colleagues here might not be familiar, and it's an important part of the work that we are doing in BR UK. So can you just give us
Yes.
a quick intro in a minute?
Thank you. So basically, intersectionality is about the ways in which we're all multiply positioned in different social categories. So nobody is, for example, only a woman or only white or only from the working classes. Everybody has a position in all these things to do with disability, sexuality, all at the same time. And so a crucial thing in research is thinking which differences make a difference, and not assuming that simply because we want to study, for example, women, that any women can speak for all women, and that is participation. If we're genuinely interested in equalities, diversities, and inclusion, then we also have to think intersectionally.
Really, thank you. We're going to close this panel just with a few reflections from me. So I've got 3 points I want to make before we come to the Q&A. We've been, for us, the purpose of this scoping review, as I said, is to try and take a stock of where the field of behavioral research seems to be regarding public engagement and stakeholder involvement. And the more I've seen the results of the scoping review, the more it reminds me of the trajectory I've seen in other fields as well, in policy studies, in science and technology, especially in science, in controversial science and technology. All these different fields have followed their own trajectory regarding public engagement and stakeholder involvement. And in many of them now, it is a fundamental part of how the field works. But it does seem that in behavioral research, the field is still tilted towards one side of the spectrum of approaches, from the extractive to the more co-productive types of engagement. So there are implications of this, because we need to think very carefully whether that is serving the purpose of informing our research, informing policy, and bringing communities, public citizens with us in the work we are doing. Of course, this is not just a gap. This is an opportunity to do more at the more engaged side of the spectrum, more co-productive approaches, more deliberative approaches. There is a question that the scoping review really throws into relief, which is whether this is the field at the moment is very top-down, consultation being the prime mode of engagement. And of course, good consultation can do a lot of good. This is not to say that there is not a role for consultation, but when most of the engagement work that is done is consulting, what we are living what we are kind of doing is not moving to the type of engagement activities where people are not just asked to react to something that we're proposing, but are actually part of the process of setting the agenda for research, helping us to make sense of what we are finding, helping us to translate into policy implications, into implications for practice, for informing services, etc. So I think there is much more to be done in the behavioral research community in terms of including people in agenda setting, so that we are answering questions that communities of all kinds, again, communities of place, practice, identity, interest, the kind of questions that will help them to deal with the issues they're having to deal with, the problems they are having to address. More involvement in the research design. There is a lot of scope. Some of the most interesting experiences I've had as a researcher were when we brought people with us from inception in defining the research questions and making sure they are relevant, they are meaningful, and they are going to bring up results that are going to be usable and useful, but also involving people potentially in data generation. In some of our projects, we have trained people to be able to conduct their own research, which of course leaves an important legacy behind, because you're helping to build capacity in communities to carry out their own research. People can also be brought in to help with interpretation. and to help with translating findings to see what do they mean in terms of informing policy and action. So a lot that can be done at different stages of the research process. But my concluding reflection is an overall kind of point. It seems to me that this is a key moment for reflecting and recalibrating the role of engagement in this field. It's a key moment because we have learned a lot from the pandemic, and in the post-pandemic period, it has become very clear how important it is not just to engage with publics, but to make publics a key part of the way we think and do research. And given the social, ecological, etc. challenges that we're facing, this agenda is more important than ever. With the growing influence that behavioral research is gaining, the implication is that we need to be much more serious about sustaining our license to practice. That means the legitimacy and the capacity that comes from public support and engagement, so that we avoid the mistakes that have been made in other fields that only embraced engagement when they had existential crises. I'm thinking here, for example, of the GMOs, the genetically modified organisms research agenda that was, strongly affected by a lack of public trust. And, we shouldn't wait until we are at a moment of crisis for the field to realize how important taking publics with us and working with them is for the future of the field. So in a way, it seems the right moment to try and recalibrate the field and think more carefully about the type of engagement that we need to do in order to make the field robust, productive, impactful. Okay, so those are my reflections, and now I'm going to take off my facilitator hat, and I'm going to hand over to Julze, who is going to help us to field questions from the Q&A box and to allocate them to myself or to Anne or to Carrie. And we're going to do that for about 15 minutes, and then we will wrap up. Julze.
Yeah, thank you, Oliver, and all to the panelists. It's very interesting insights from you for the reflection on the scoping review. So there are a couple of questions in the chat, and one of the questions from Linda, for example, here is, which I would like to address to all of you, is given limited resources, how best to conduct public engagement and stakeholder involvement in behavioral research if the budget is really small?
I'm happy to have a first go. I mean, sometimes, resource is necessary, of course, but now, to give credit to research funders in the UK, engagement of some kind, sometimes public engagement, sometimes a stakeholder engagement, often both, is now expected. And many colleagues here will know that when we are putting together grant applications now, it is expected that we will budget for that, and we will make it an integral part of what we are proposing. But there is also another side to this, which is that there are all kinds of spaces in communities across the country, spaces in civil society, community organizations, all kinds of third sector networks, that often, we need to make a stronger effort to go to where they are. And in many ways, sometimes they are already doing all kinds of engagement. We don't tap enough into that. So this is as much about being a little bit more outward looking and going to places. In one of our projects, for example, what we did was to embed researchers in local organizations, housing associations or a local authority office, or so that them, instead of us having to organize all the engagement, we were being part of the kind of engagement processes they were organizing, and we will helping with that. So partnerships are really important, and not expecting that this should be a centralized approach where we are hosting the space, creating the space, bringing people in. Sometimes it's about going to the real places where these things are happening anyway, and adding a research dimension that brings value to those spaces that are already doing engagement.
Brilliant, thank you. And would you like to say something?
Yes, yeah. I would. I completely agree with what Oliver said, but what I would say is that if money is scarce, then we do need to make links, as he suggested, with organizations that are often thought of as community organizations, although the word community is a broad one. And so we need to do that. But in order for it not to be extractive again, we really do need to think in advance what it is that they would gain. So we're not just wasting their time. And also we need to make sure that we're doing that in an openness that allows them to shift our agenda as well. And that's sometimes the difficult thing, because by the time people are funded, they've already said what they're going to do. So I think that often, if we're going to do good public engagement, we need to do this process before we've put in the proposal, before we do have much resource.
Yeah, Jules, if I can add just one other point, the thing that sometimes we don't factor in is the cost of not doing engagement. And the cost of not doing engagement is policies that are not well informed, is decisions that perhaps then are going to create backlash because they are not grounded in the lived experiences of people, is research that perhaps is of value from a research perspective, but not necessarily from a policy or a practical perspective. So there is a cost to not doing this as well if we want to get instrumental about this argument as well.
Yeah, so I think in terms of that question regarding budget, so there's a question from Elizabeth in the chat which I just saw. So what would you recommend research commissioners should do so that there might be more resources or capacities for public engagement and research? Because sometimes, from what I've experienced as well, like research grant application would come in very late, or like there's very limited time frame. So and there's limited time as well to do public engagement just before the research is being developed. So what would you recommend commissioners should do in terms of this? Do you have any thoughts, Oliver, Anne, or Carrie, for example?
Yeah, I'm just conscious that I'm speaking a lot. I'll just say, part of this as well, and it's part of having a non-extractivist ethos, is to build relationships over time beyond the span of a research project. A lot of the people we work with, it's an ongoing relationship. It's not just about a specific piece of research. Now, that takes time, and we know we are in a context in higher education and research institutions where sometimes this is not valued, sometimes it's not as visible as other aspects of what we do. So we need to keep making the case for the importance of ongoing collaboration, ongoing partnerships, and the time to invest in building those relationships. That is crucial. In a lot of my recent research projects, both of them had a lot of groundwork 2-3 years before the projects started with people that I've been working with anyway, in communities, in third sector organizations, in the public sector. So, relationships, again, that go both ways are key to all of this.
Yeah, thank you. Sorry, Anne, would you like to add more?
Yeah, just a little bit, which is Oliver said himself that funders are beginning more to recognise, because the research landscape is changing, that this is an important area. And I think that it is a question of encouraging them to think more about, sometimes giving little bits of money that will allow for some engagement before a big project is done. And sometimes they are doing that. So that sort of thing. And I know myself from being on the Nuffield Foundation Trust Board that the executive there are really thoughtful about what would be helpful in research and so on. So it's not that some commissioners are not already trying to think quite hard about how to manage such issues.
Okay, so I would like to go on to the next question in the Q&A chat, which is from David, which I would like to address to everyone, specifically, especially Carrie. So David asked, in which areas of policy or regulation should we not use public participation?
Yeah, I think Carrie is not here. She might be having some issues with her connection. But I guess what I would respond to that is, and hopefully you will see the implicit answer in the question I'm going to ask, is you don't need to use public or stakeholder engagement in areas of policy that don't affect members of the public or stakeholders, which is another way of saying it's really hard to think of any area of regulation or policy that is not going to have an impact on people's lives. And if it's going to have an impact on people's lives, it is a basic democratic expectation that people will have a chance to shape the things that shape their lives. And I think we need to take that role much more seriously in research. We know that we are at a very challenging time in terms of the challenges of democratic governance, but also, the public trust and our capacity collectively to address some of the very difficult challenges that are going to shape the world over the next 10, 20 years. So, I'm sure there is some area that doesn't affect people. I can't think of any.
Okay, so I see Carrie's back. So Carrie, the question was, in which areas of policy or regulation should we not use public participation? Do you have any thoughts? Okay, I think I'll just move on to the next question while Carrie is.
Can I just say something about this? I agree, of course, with Oliver. There is no place where there shouldn't be public engagement. But in thinking about David's question, there are times when, for example, governments don't consult because they think that the policies they want to implement are different from what people will answer. If you think about in Britain hanging, for example, where there's a belief that the public would be all for it, and we're not going to bring it back. I would say that one should still consult and understand what it is that people are concerned about and so on. I mean, that probably doesn't come up high up any government agenda to spend money on that kind of consultation. But actually, it is important to know what people think, why, if one is to make genuine change, even if one disagrees with the policies, or the policies would go against equity and other issues that come up.
Thank you. So Carrie, would you like to
try? Can you hear me okay?
Yes.
Okay.
Yes.
Profuse apologies. All of my tech has gone down at once. I think that going back to the question in terms of what if there's areas where public engagement shouldn't be used, and apologies if I'm restating things that Oliver and Anne have already said, but essentially where there's no scope to actually take any of the outcomes into the, so if essentially decisions are already made or have been made, or there are particular political operational factors that mean that there is no scope for bringing in sort of the public in a substantive way. That's what I would, I would say that those are the areas. So it's not necessarily a particular policy area, but it's more the sort of conditions.
Yeah, thank you, Carrie. And I would like to throw in this last question. I know we have 2 minutes left to answer this question, but I think this is really important. So, Anne, you talk about diversity, equality, intersectionality a while ago. So the question is from Stephanie and Laura. So how would you advise researchers to initiate engagement with a largely disenfranchised community? And how would you manage consultation fatigue in third sector organization, or are usually being engaged with, or have been engaged with a lot of research already?
Yeah, I think those are really important points. And the first comes back to making sure that one engages with organizations that are already working with particular groups, and there always are some available, that one finds out, or that one goes to particular localities and uses social infrastructure that people do to build up trust and so on, so that there are always ways for engaging and making sure that one gets a diverse range of people, and recognizing that one has to think about diversity is, I think, really important. And then about the consultation fatigue, that is about showing that one is actually using the participatory process in a way that's not just extractive. because part of groups not wanting to be researched is about feeling that actually it's used against people's interests, or that it's only done to make researchers look good or for their careers, and nothing comes of it for people. So that I'm afraid it is a process that requires actually the commitment to making change, or at least to showing that people are being taken.
If I may, just a quick one
Yeah.
here, something very practical that anyone who is thinking about putting together a grant application should consider is that now, for some years at Edinburgh, as a default, in any grant application we do, we always propose and budget for an inclusion fund, which is a fund to remove barriers to participation by either individuals or organizations, which might be small charities or small community groups, that otherwise wouldn't be able to participate. It is unfair to bring people in, into a process in which there might be researchers who are paid to be there, public servants who are paid to be there, maybe larger third sector organizations, again, they're paid to be there, and then to expect others who do not have those resources to come in and give up their time. So an inclusion fund, and I need to say that I don't have any scientific proof of this, but every project grant I've put forward that had an inclusion fund has been funded, and the ones when we didn't have it, it hasn't. So they weren't. So this is to say that funders recognize the importance of this, and they like to see measures in the way we propose things that cater to this.
And the other thing that I would say is that the inclusion fund should include asking people for their time to review proposals, because quite often groups will refuse to do the reviews because they don't have the time, they're not being funded, and so on.
Yeah. Thank you so much. And that ends our Q&A for this session. Thank you so much for all your questions. I appreciate there are some questions that we're not able to answer. If you put your name, I see some of those who submitted their questions. We can probably answer your question through email if there's an opportunity. So just since this is the next step from my part, I think I just want to kind of like very quickly add that the application of inclusive, appropriate, equitable, and context-based, and also meaningful public engagement and stakeholder involvement approaches is very vital and important in the co-production of behavioral research evidence that is useful for informing policy and action. And I hope the result of our scoping review would make you think about what engagement processes you could be using in the future if you want to do research in different fields. Next slide, please. And I think for my last point and last slide, sorry, next slide, please. I would also like to just acknowledge our collaborators. So as you know, BR UK is a consortium of different universities in the UK, but also we are collaborating with members from different government, UK government and devolved governments of the UK. But we are also have partnership with other third sector organizations. And lastly, next slide. Okay, I see the slides are not moving, but just to mention, I would like to invite our attendees to join the next webinar on artificial intelligence in behavioral research. And if you'd like to hear more about BR UK, you can connect with us at www.br-uk.ac.uk. And if you would also like to hear more about BR UK, you can also connect with us or follow our social media handles in X, LinkedIn, and Blue Sky. And from us, from the Public Engagement and Stakeholder Involvement Work Package, we have a lot of things to offer in the behavioral research community. We're going to launch a national survey on behavioral researchers' capability on public engagement and stakeholder involvement application and behavioral research. We're also going to have a capability building program for PESI, or public engagement and stakeholder involvement in behavioral research, in the coming years. So I hope you would follow us and you will be looking forward for these opportunities. And thank you again for all the attendees of this session. And thank you for our panelists and speakers as well.